So the nurse is caring for clients on a medical floor. Which client is the highest priority? A strategy that I like to use when I see a question that gives me 4 different patients, I try to identify which patient is stable versus unstable. I try to identify if there is a patient that has an acute condition versus a chronic condition. I try to identify if there is a patient that has some kind of airway, breathing, circulation compromise. So as I review my answers, I try to think about that. So patient A, 84-year-old, exhibiting uncontrolled atrial fibrillation. Letter B, 60-year-old, exhibiting asymptomatic sinus bradycardia. So let's compare A and B, and I like to do that. I like to compare one patient with the other and start eliminating. Remember, I always use the process of elimination. So if I compare A and B, who is worse? Uncontrolled atrial fibrillation or asymptomatic sinus bradycardia? So the word asymptomatic tells me that the patient is not experiencing any symptoms. So I think B we can eliminate. Notice, I'm not looking for the right answer yet. The only thing that I do was compare A and B. So now B is out of the way. I will compare A and C now. A says 84 uncontrolled atrial fibrillation. C says 53-year-old exhibiting ventricular fibrillation. Oh, we got a problem. Because we know that ventricular fibrillation is a deadly dysrhythmia. This patient needs CPR and defibrillation soon. So A and C is in a worse condition or a more unstable condition. So I eliminate letter A. Now I'm going to compare C and D. D, 65-year-old, exhibiting supraventricular tachycardia. This is a big problem as well. But notice the word supraventricular or above the ventricles. So what is a worse scenario? Ventricular fibrillation or supraventricular tachycardia? Ventricular fibrillation is the worst condition. So the answer is C. Now, you may look at this question and say, oh, professor, this is easy. I know ventricular fibrillation is the answer over supraventricular tachycardia, over asymptomatic sinus bradycardia, over uncontrolled atrial fibrillation. However, I am teaching you thinking process. Use the same process in whatever the topic or situation. The problem that I see many of you have is that you do not have a system. You fail to analyze questions the right way. And the only thing that you're using is content. When the questions gets more difficult, when the scenario is not as clear, you don't know what to do. I'm teaching you the steps first. I want you to improve the critical thinking process. I want you to have a system at your side, and then we will review harder questions, a more difficult scenario. But this is the starting. This is the beginning steps. Because if I start giving you super difficult scenarios, you'll be like, I don't know what I'm doing. I'm lost. And we gotta take baby steps. Okay?